just going to kind of go over some quick things. I know there was an incident over the last week or so, and you see it happening more frequently, right? Things start showing up in the media, they seem to just randomly start happening a little bit more frequently, like the bar handling incidents, things like that. And it is very common in a workout setting to have someone start having chest pain, and sometimes it evolves into a heart attack or cardiac arrest, right? And it can happen to anybody. It can happen to LeBron James's kid running down the basketball court. It could happen to a 60-year-old man that's working out and's been working out their whole life and running a marathon. It doesn't matter. So some of the real quick and easy things. Like she said, I'm Matt Clark. I am her older brother. I work for Cincinnati, and I also work part-time at Marymount Fire Department. I'm a paramedic and fireman, and I'm basically here. I'm going to show you a couple things that you can do right off the rip if someone starts having chest pain, what to look for, and what you should do. So yeah, essentially, but this is not like an AHA class, so I'm not going to be able to give you guys all cards, make you all CPR certified, and take tests or any of that. This is just like a down and dirty. This is what we should do right off the jump. So if someone's complaining of like crushing chest pain after a workout, obviously you're breathing hard, especially when it's cold, it starts to burn a little bit. When they're talking about, I feel like my chest is squeezing me, they start changing color, they start sweating more than they already are. The best thing to do is to, one, call 911 and get that started, right? So you want to get somebody to call 911. Basic things that you're going to want to know is age, gender, and address. Those are like the big three things that you want to be able to tell them. About how old is the person, is it a male or female, and where are you? So they've wrote the address up here, so that's something if somebody's grabbing the AED to know the address. And luckily for you guys, there's a firehouse like maybe 200 yards that way. So the first thing you want to do is obviously get someone to call 911, you would grab an AED. The person that's having pain in their chest or anything like that, if they're sitting down, that is good. You want to get them to sit down and try to regulate their breathing. The next thing you would do is you want to actually try to get them onto the floor and lay them flat, right? So if their heart's beating too fast and they're not able to get that oxygen throughout their body, they start hyperventilating. Laying them down flat and even just elevating their feet a little bit can help recirculate the blood back to the heart. So if their blood pressure kind of gets too low. All right, so the first thing that you want to do is once you've got them down on the ground, all right, now if they're responsive and they're talking to you, you're not going to push on their chest, right? If you're like, oh, I don't know if they're really hurt or if they're really having chest pain, you do one press and they're like, hey, don't continue that, right? But you can still apply the AED. So you send someone right off the jump to go get the AED and call 911, like I said. So the AED is very, very simple, okay? On the back side of this, there are pads, right? So instead of using their pads, I brought some of our own. So the first thing you're gonna do, this thing is gonna coach you through absolutely everything. It is as simple as it can be. You simply turn it on and it'll say, connect electrodes or check pads, and what it is basically it's trying to see that this is connected to it. All right, so when you pull the pads out, all right, you can put these on them, like I said, whether they are conscious and they know what's going on or if they are completely out of it. It does not matter. It's not going to shock them. This is not the old show ER where they've got the things, the gel, and they start shocking people. It's not like that. There is the ability to have electric in here, but it's not going to do so unless it determines that it needs to. All right, so it will tell you on the pads where they're supposed to go. All right, so these pads, what you want to do is when the heart gets in a rhythm that it needs to be shocked, what this does is that it replaces the electrical current and restarts the heart, right? It's like when your computer freezes and you're like, you just hit the power button. It's the same kind of situation, right? So what you do is you will take one, you want to put it high right, low left. That's the easiest way to remember, and that makes a current go through the heart, okay? So these are all sticky, and you'll place one up here. If they have jewelry, ladies or men wearing a bra, anything like that, anything around their chest, you want to get under that material and make sure that there's no like jewelry or anything that are hanging around there. So you want this to be on the skin. If the person has a hairy chest, I told Maria, they're going to put a razor, like a disposable razor in here, shave that area. And if that doesn't work, then you can actually just use the pads, put them on, rip that hair off, and then put it back on. Yeah. Last thing you want is to smell burnt hair because it's going to go right across the top of the chest. It's not going to make connection with the skin. And then you're just going to have a burn line all the way across the chest. So once you've got this on and you set them up and you realize, all right, they're not breathing or they do not have a pulse, you want to check, make sure that they have a pulse. All right, so you can start right off the jump. If they are not alert and oriented and they are completely unconscious, check their pulse. All right, if there is no pulse, the first thing you want to do is literally grab your hands like this. You're going to go right on the breastplate. And you're going to push. All right, as Maria would tell you, probably contract the core, flex the glutes, whatever it is. But you're going to go hard and fast, right? So they always say, like, staying alive, the old song. So you want to go on beat with that. Staying alive, staying alive. So that's how you can keep the rhythm going of how many beats that you should be doing, how many compressions you should be doing. So you can continue doing that until this arrives and you're able to put these on. Once you put these on, you're going to stop and turn this on, and it'll say check the pads, and it'll say analyzing. All right, so what it's doing is you're going to step away, you don't want to touch them. It's going to determine whether or not their heart is in a shockable rhythm. If it is, it'll say either shock advised or no shock advised. So if there's a shock advised, let's say, okay, all right, everybody back up. If they're wet, if they're laying in a puddle, whatever it may be, you don't want to be around that. If they are wet on their chest, you might want to wipe them off real quick. Towel, your own shirt, whatever you got, just something. But everyone needs to back away because there's going to be electrical current that's going to go through, and you don't want to be touching them and get zapped yourself. It's not fun. So it'll say shock advised. You press the shock button, and then you're going to go right back to your compressions. Okay? They used to say, like mouth to mouth. They don't really even teach that anymore, just because of all the diseases, and a lot of times they vomit. Yeah. So a lot of times, if they're cardiac arrest, they vomit. Sometimes they may have an accident in their pants. You don't know. And there's all kinds of different things that kind of get messy. So the last thing you want to do is put your mouth in somebody that ends up throwing up. Right? Now, if it was my own child, I'm going to do that. But anybody else, I'm not. It's the reality of it. What they have determined that is actually, even if you're not giving them breaths, you're not breathing for them, there's still enough oxygen in your body that as long as you're compressing that heart, the oxygen in your bloodstream is going to continue to preserve your organs and everything else and continue until they get here. I forget the exact time frame, but you have enough oxygen in there to continue CPR until they're actually going to get here and start banging in person. So as long as you continue with compressions, that's the biggest thing. Same thing for kids, it's the same way. And then, hopefully there's no babies or anything like that. That's the only time that becomes a little bit different. But if they, just for educational purposes, it's 30 and 2. So if somebody had like a pocket mask or something or anything like that, it's 2 breaths, 30 compressions, 2 breaths. And make sure you rotate out if you're going to be here for a long time, because if you're doing this and you're not actually able to push down and it's not doing anything, you're tired. And you need to really get a full, you want to hear that click. You're not going to hear that obviously in person. But don't be afraid when you push down, you might feel some popping. All right, what that is it's cartilage in between the rib cage. All right, that's okay. They're not going to get any worse than they already are if you're doing this, right? So don't worry about that. You're not going to push a rib through their heart. Even if you do, you were with good intention, and it's not going to change the outcome of what was going to happen in the first place. Okay? So there it is. Very simple. If anybody wants to press on this or feel what it feels like, this is about the right pressure that you need to put down on a typical human being.
So you only do one shot and then that's it?
So you will continue to do this, and then every 2 minutes you'll look and it'll tell you. So it will actually come back on and say, clear the patient, analyze it, and then it'll tell you whether or not the shock is. So it's about every 2 minutes it'll tell you to do that.
If you're somewhere without an AED, is it just do the compressions until somebody arrives?
Yeah, so if there's no AED and you feel and they do not have a pulse, and, I mean, you can feel it here, you can double check on their wrist, and if you do not feel something and they're completely unconscious, you start pressing.
Okay.
If you don't have an AED, just keep pressing.
Okay. Don't stop.
Yeah, just don't stop.
Okay.
Just keep going and rotate out as you get tired.
Does the shock happen automatically when it detects that it's ready?
Good question. So what it'll do is it'll say shock advised, and it'll say clear the patient, and then that's when you're gonna say, all right, everybody back up, get away from them. Okay, everybody's away. Then you're gonna press the shock button, and you'll see it. It'll kind of jump, and then it'll say resume compressions. And that's, you're just gonna go right back to it.
How often does will someone get cracked? A cartilage or like if you move along my old front red?
So you're gonna go right around just above like the nipple line. So right in that sternum area is where the heart is, and everybody says like, hand over your heart. And the heart's actually right here. It's right in here. So when you're pushing down right here, you're gonna be pushing on the heart. Basically, what you're doing is you're compressing the heart and pumping. So yeah, as long as you're pressing right there, you're fine. You don't want to be pressing down here. You're just pushing on their stomach at that point. But anything up here, you're gonna feel it. You're gonna feel cracks, especially if someone's really small. You're gonna feel cracks, and it's part of it. It's okay. They'll thank you when they wake up. Yeah, it's just like it's just it's just like a piece of torn cartilage. Like it will eventually. They're gonna be sore. They're gonna hurt, but if they're alive, they're gonna be happy, right? So yeah, it happens. Any other questions? Anything? Feel free to push down on this thing and kind of feel what it's like, and